Good evening everybody. I am Dr. Puneet CS, consultant neurologist at Sri Gokulam Hospital, Salem. Today I will be talking on one of the disorder which is coming up recently, which we were seeing only in developing countries initially. Now we are seeing lot of patients in India itself or developing countries. So what is dementia? So dementia is a disorder of brain causing memory disturbances. So how do a patient with dementia or patient with having disorder of memory come to you? So they usually come with history of forgetfulness. So what is forgetfulness? They will forget what they have eaten in the morning, where they have kept the keys, they will forget their phone numbers, they will also forget their bank pin code and bank details, and they also have disorders of attention and concentration. Patient also will have disorders of speech and writing. They will have difficulty in speaking, they will always have difficulty in recognizing faces, they will also have difficulty in writing names. If you tell them to write their names, they forget, and they also forget the day to day activity. For example, if a patient who is always his occupation was writing in the desk, he forgets whatever the learned activity he had, he forgets. Then patient can also present with history of the disorientation in the place. For example, they will always like familiar surrounding, they will forget. In their own house, they forget where is the kitchen, where is the bathroom, and where is the bedroom. So many a times while going to the kitchen, they will think that it is bathroom, and they will go. Many a times they will urinate in the kitchen. So it causes lot of emotional turmoil to the family members itself. Then patient can also have difficulty in reasoning and attention. Patient can also have, in severe dementia or severe memory disturbances, they can have urinary incontinence and fecal incontinence, and patient also present with behavioral disturbances in the form of severe anger, severe depression, and patient can also have disturbances in the form of hallucinations, wherein they see imaginary visual objects or animals in their visual field, especially in the night times, and delusions and hallucinations. They are many a times dementia patients, they end up with psychiatrist then upfront, and then they will be referred to a neurologist in the later this one. So what are the risk factors for dementia? The most important risk factor for dementia is age. So they say that people beyond 80 years, 80 to 85 years, 1 in 6 is having memory disturbances. From 85 to 90 years, 1 in 3 is having memory disturbances or dementia. So beyond 90 years, they say around 50%, like if say 100 people are there beyond 90 years, 50% will have memory disturbances in some form of other. So and the other thing is family history. So family history, especially in Alzheimer's dementia, there is a type of dementia known as Alzheimer's dementia. Family history is very predominant, wherein there is a significant history of memory disturbances in their father and forefather and grandmother and all. In those cases, family history is very significant. Then there are other risk factors like uncontrolled diabetes, uncontrolled like BP or high BP, along with high alcohol intake or smoking during the younger days. Patient who are having a very severe poor glycemic control and high BP, they are more prone for dementia in the future course. Then the other risk factor is nowadays we are seeing in terms of loneliness. During their younger days, the social interaction, if it is on the lesser side, patient is always lonely, and social interaction is less. Those patients also, and physical activity is also on the lesser side. They say that there is a study going on wherein they have followed patients who are having, based upon the physical activity, how many patients have developed dementia in their elderly group age. They have found that patients with lesser physical activity like sedentary lifestyle have developed dementia as they grow more. Then what are the types of dementia? So as we call it as dementia is an umbrella term. So what is the types of dementia. The most commonest type of dementia in the world is called as Alzheimer's dementia. It accounts for around 60 to 80% of dementia. In Alzheimer's dementia, there is loss of a particular brain cell in a particular part of the brain called as temporal lobe. And why this occurs? There is a deposition of a material known as beta plaque. So, there is amyloid plaque that deposits in particular part of the brain, and there is destruction of the nerve cells. So, this is one of the commonest dementia. Then we have vascular dementia. Vascular dementia is very common, wherein patient will have multiple small strokes, and which have a stuttering course. So, they will have multiple small infarcts in the brain, and they over a period of time they develop dementia. Then there are other types of dementia known as frontotemporal dementia. There also there is destruction of particular part of the brain. Then we have some certain dementia which are due to secondary dementia, like for example, patient is having a thyroid disturbance, one of the commonest disorders. So, any patient with memory disturbance or dementia, we always evaluate with them with thyroid profile. So, this is one of the most important thing. We have to rule out patients having a normal thyroid before going in for further workup for dementia. So, hypothyroidism or thyroid disorders is one of the commonest cause for a treatable cause for dementia. Why we stress upon this is because dementia treatment per se, like medications are very few. We can just try to arrest or slightly decrease the progression of the disease, but we can't alter it will definitely progress, but we can just delay the disease process. But these disorders, like for example, vitamin B12 deficiency, there is another treatable dementia wherein we give injection shots of vitamin B12, the dementia can be cured. And these two, especially this thyroid related dementia and B12 related deficiency related dementia, it is totally treatable by replacing thyroid as well as vitamin B12 respectively. So, then there are certain dementia wherein usually this memory disturbances always goes on very slowly, but there are certain dementias which progress very rapidly. Especially there is a very rare disorders known as prion disease, CJD disorders, wherein slow virus disorders, they develop memory disturbance in a span of 2 to 3 months. Then there are dementias like rapidly progressive dementia and with weight loss and all. In those cases, malignancy, we also have to rule out malignancy, and in the age of PET scans, so advanced imaging and various biomedical markers, we are able to detect. And like many a times patient has come with dementia, retrospectively we evaluated with PET and then found out, okay, this is the malignancy, and they were treated. We call it as paraneoplastic syndromes. In those scenario also patient can develop dementia. So, dementia per se, like in case of malignancy presenting with dementia, the malignancy might be somewhere, like for example in the liver or in the gut. So, but the patient present to a clinician with dementia, and retrospectively we evaluate and find out that patient is having some cancer, and then you treat accordingly. So, you should keep it an open mind and then evaluate for the various cause of dementia. So, how do you evaluate for the cause of dementia? As I told, blood tests, like routine blood tests like vitamin B12, thyroid profile. We also do routine biochemical markers like sodium, potassium. Many a times hypothyroidism and hyponatremia, like low sodium also can present dementia. So, chronic hyponatremia, chronic metabolic disturbances like uremia also can cause dementia. Then we also do advanced imaging in the form of the minimum imaging we do is MRI brain. In MRI brain, they also have doing functional MRI, wherein we can know which part of the brain is affected. So that we can tell that, okay, what type of memory disturbance patient is having, accordingly it can be addressed. Then after diagnosing the type of dementia, then we treat them. So, how do you treat? Treatment in the form of, one is, the most important aspect is not the medical management, all the non-medical management is the most important aspect. First, we should counsel the caregiver. Many times any patient who comes with memory disturbance to our OPD or to the hospital, the history is given by the caregiver. The son or the daughter will give the history that, okay, he has wandered away from the house, This is grave consequence. Many a times they will not be found in the house, and they will be just wandering. They will not be able to find the, like for example, if they have gone to the grocery to buy something, they will not be able to come back to the house, or they will forget to put signature as they, and many a times they will forget the pin code, and this is has lot of social implications. First we have to address those things. When like dementia clinic we have to have, and there are a lot of counseling is required for these things. Then comes the medical management. Some medications are there, especially for Alzheimer's dementia. We give medications to increase particular chemical, so that the memory is enhanced. This is not reversing the disease as per se, but lot of researches are going on in US wherein they are trying to reverse the disease per se, but it will take some time. But as of now, there are only medications like donepezil, rivastigmine, galantamine, and few medications are there which only postpones the disease process as such. Then we give medications to other risk factors, like for example, controlling of BP, controlling of the sugars and all is very crucial in patients with dementia. Then as I told, vascular dementia, we give antiplatelets, blood thinners, and also statins, so that for the control of small stroke and all, so that the deterioration of memory is prevented. So treatment of dementia is not only, the most important thing is not medical treatment, then recognizing what is the disorder, then teaching the whole family and caregivers about what is the disease process, how it progresses, and how to take care of the caregivers, like, and then we can give at least a meaningful life for dementic patients. So thank you.